The Wisconsin Dental Association is working to provide tips for families on how to prevent early childhood tooth decay and cavities. And joining us this morning to discuss ways to do that is Dr. Deepa Satya. Good morning, doctor.
Good morning, Mike. Thanks for having me.
So, doctor, when we think about, obviously we know brushing your teeth is great, flossing is also very important, but what are some other things that maybe parents can add to their children's arsenal in terms of keeping those teeth nice and clean?
Sure. So this is the month of National Children's Dental Health Month, as you already mentioned. So there are a few tips that I'd like to break it down to things that you can do on your own and some of the things that you'll need the aid of a healthcare provider. Of the things you can do on your own, the number one thing would be to limit a day-long snacking or grazing. Because it's not only the type of food that's being consumed, but the issue is the frequency. So every time you consume a carbohydrate, it can attack the enamel for up to 20 minutes after. So some of the things you can do is to encourage the child to have 3 good meals. And then drink plenty of water. Water not only washes away those food particles, but also keeps them hydrated. Also choosing water instead of sugary beverages, such as juices, soda, all that can help. The second thing, yes, you did mention brushing and flossing, but children at that age, most of them don't have that coordination to get to the back of the molars, also along the gum line. So assistant to brushing twice a day and flossing once a day helps a lot. And the third thing you can do is definitely take them for regular dental visits.
Well, when you're thinking about a diet for your children, do you usually encourage, more fruits and vegetables, kind of really put an emphasis on that?
I would think vegetables more so than fruits, because fruits do have that carbohydrate. So, but every time, like I said, limiting those, the frequency of those kind of diets, even though they're fruits and even though they may be considered healthy, limiting the frequency of those or combining them with a meal should certainly help. Getting them off those teeth is mainly the criteria. So the longer they stick to the teeth, the higher the incidence of decay.
Well, doctor, we really appreciate your time this morning, taking some time to talk about ways to keep our children's teeth safe, kind of avoid some of those cavities. I know it's always a bummer when you do get one and it takes more time, but we do appreciate all your tips and your help this morning.
Thank you very much, Mike.
All right, and now we'll send it over to Alyssa.